Welcome back. And for this week, I spoke to the former PAG chair, Dr. Hoa Nguyen, about his thoughts on the recent COVID uptick here on Guam. Dr. Hoa, as you may well know, our cases are slowly going back up. And according to public health, they've actually expected this since they lifted the mask mandate. So can I just get your thoughts about why you think the cases have been going up?
Yeah, the case going up, there's multiple reasons, right? The number one is that the restriction is gone. You know, the mask mandate, the restriction or limitation of the gathering. So yes, we expect the rate to go up, but there are other reasons that we should be do some correction on the local level to try to kind of curve this. The surge, that's why I call it surge, is going to go up more in July and August, right? The number one thing is that, as you know, the booster have been rolling out very slow. You know, I think less than 34% of the population are boosted, you know, and that's very, very important to kind of prevent you from getting infection, also cut down the rate of hospitalization, right? So right now, you know, when you really look at it, we really need to kind of step up the booster, right? The campaign and open the clinic a lot more so people that need to have the booster get access to the clinic. Right now at the clinic level, like at AMC, and I can speak for the clinic too, is that we are getting back on a normal level and taking care of chronic care management. So a lot of the nursing staff now, we really cannot, you know, do a booster clinic like before because, you know, now that we need to take care of the diabetes, hypertension, cholesterol. So now it's all public health. You know, this is really, public health need to really step up the booster clinic to make sure that people have access to get the first booster, which is the majority people need the first booster. The last shot is about a year ago for most people, right? But when we look at the jig, I think that again are only like 3 days a week, you know, and they really need to open like 6-7 days a week so people can walk in and get the booster because the demand will be there because people see that the positive rate are going up, you know. So, but just 3 days a week and 3 hours a day. No. It's not going to cut it. You know, even my patient that I refer to a Gang shopping center, and they say that they go there and it's closed. So that's number one. So they really need to step up the booster, and also we need to kind of open the testing longer, right, and more days. You know, right now we always expect the surge to come up. But if you limited the number of testing for people to go just 3 days a week, and from 8 to 11, they do Tuesday, Thursday, and Saturday, 3 days a week, it's not convenient for people. You know, they rather go to work when they get sick, rather than go get tested because it's not fitting to that time. So I recommend that. I know they have public health put out the 3 criteria for surge, but we don't need to get to that 3 criteria. We need to jump ahead of time to kind of try to prevent the surge from coming, right? So right now, you know, I know the JIC report like 3,000 tests, something like that, but it kind of question is that many tests done for the local population? I think that those thousands of tests, they kind of mixture of the local population, but the majority of them is the tourists, right? Public health doing the tourist testing 7 days a week from 9 to 4 down to 1. And the majority of the tourists are negative. So if you take the 1,000 of tourists that are testing out of the total reported, it'd be interesting to see what truly the positive rate of the local population. That's what we need to know. You know, so if you're testing 400 of the local people, and you got 200 positive, and you got 40-50%, that really changed the equation a whole lot. So I'm not quite sure the JIC report, just the local population or the local plus the majority of tourists, because the local population really only 3 days a week, but the tourists are 7 days a week. And for 7 days a week, it's 6-7 hours a day of testing, so you have thousands of tourists. So we really need to break that down a little bit more so the clinic can get prepared and public health need to get prepared. So again, I think right now the booster need to be really ramped up on not so much the kids. We talk about kids from 6 months to 4 years. Well, we shouldn't concentrate on them. We should concentrate on the 40 years old and up with the first booster and also the testing. So I think those things we really need to do, because July and August, it's not going to be so rosy during the summer, because there's a lot of tourists coming, but if our rate will keep going up, and right now from the CDC, we are at the high risk now. We're no longer in the low risk. So the tourists might not come, so we really have to take care of our local population.
Doc, so just to backtrack just a little bit, what can you say to the people of Guam? Because our cases are slowly going back up, and if it continues to go up at this rate, we'll eventually see like 100 cases every day now, which we're somewhat already seeing. But what can island residents do to help curb this little uptick in cases right now?
I think that there are a lot of home tests now, right? A lot of people want to do home test kit, and they need to understand that every kid coming with 2 tests, right? It's not for 2 people, not for 1 person, right? So if you have symptoms like cough and cold and congestion, or runny nose and allergy, whatever you think you have, if you test negative, don't go to work yet, because it might be too early. So every test kit have two tests in there. So you're supposed to test 1. If you're positive, please stay home and don't go nowhere. If you're negative, you need to retest yourself in 2-3 days. If the second test is negative, yes, more likely you have a cold, but then now you can be freely and it's not COVID related. So test negative 1 doesn't mean that you can go out and mingle with other people. You gotta wait for the 2-3 days of retesting. So that's our people. I think they know now. No, they positive. The majority of people are pretty respectful, because we go over this in 2.5 years already. They know they will stay home, right? Or they contact their doctor and say, at least for 5 days, because this is all Omicron. So, test 1 time negative at home. Please, just protect yourself, protect people around you, and get the second test about 2-3 days later. And if you test positive, just stay home, stay away from your family, don't go to work, because the majority of the symptoms of Omicron is very mild and it's not severe. The one that get hit the hardest is the one with comorbidity. So if you test positive, stay home for at least 5 days. If you're fever free for 24 hours, then you can get off isolation on day number 6. But right now, if you test positive, stay home for the good 5 days. If you have symptoms still severe, call your doctor. They give you an excuse and you can stay home the full 10 days. But I think the majority of people on 5 days should be enough already. So people should know what to do. But I think that testing at home or have access to testing site more frequent and longer hours, that would be helpful to try to be ahead of the curve in July and August.
All right, Doc, so just to wrap everything up, I did want to ask, have you met with members of the PAG to share your concerns with them?
Yeah, we talk over the chat. I don't think the PAG meet in the past month or 2 anymore that I'm aware of, just because the pandemic kind of turned to endemic now, right? So I don't think the PAG meet regularly. We chat over the WhatsApp, but we don't meet, But we do know that there's a possibility, and the high possibility that it's going to go up in July and August, So What I really recommend people pay attention to the symptom and get tested. Again, that's on the population side, right? On the public health side, it's really increase in testing site, increase in the hours of doing access, and really concentrating the booster for 40 years old and up. Because the people on comorbidity, the one that I'm really worried about, is going to burden the hospital again.
Don't go anywhere because up next is House to Home.